are living with today in fear of gun violence on their school campuses. Next, we're going to hear from Dr. Roger Mitchell. Dr. Mitchell is a Washington, D.C. Chief Medical Examiner. He began his study of forensic science and violence prevention as a forensic biologist for the FBI DNA unit in 1997. He currently sits on the National Association of Medical Examiners subcommittees for education and planning and strategic planning, and is the immediate past chair for Deaths in Custody subcommittee. Please welcome Dr. Mitchell.
Thank you, Congresswoman Spear. Gun violence is one of the largest public health crises that is affecting this country yet. We have not developed comprehensive national strategy to combat its effects on American communities. But we can. We, the collective American community, are being injured and fatally wounded by gun violence, devastating families and needlessly increasing healthcare costs. We didn't allow HIV and AIDS to go without a national comprehensive strategy. We didn't allow motor vehicle accidents to go without a national comprehensive strategy. We would have never allowed cancer to go without a national comprehensive strategy. And now, in the midst of the opioid crisis and drug addiction and substance use disorder, we are developing a national comprehensive strategy. Gun violence is no different than any other public health issue and must be solved by those who spend their professional careers solving this problem, our medical community. I'm a board-certified forensic pathologist and medical examiner here in the nation's capital. I performed hundreds of autopsies on people that are victims of violence, including gun violence. Enough is enough. I'm here representing the American Foundation for Firearm Injury Reduction in Medicine, or AFFIRM. We represent the collective will of medicine that believes that gun violence is a public health issue and requires a comprehensive national research and prevention agenda. Emergency room physicians and physicians of color, surgeons, and medical students alike, we stand here together, ready to tackle the problem of gun violence. But we need your help. We need federal research dollars to support the work that is already being done and support young and emerging researchers in the field of gun violence research. Gun violence is a problem that encompasses a myriad of causes, and therefore there is not just one solution. We need to understand the impact of interventions at every level, from education to economics, to housing, to healthcare, to mental health, and the environment. And yes, we need to understand the effects of the access to firearms, and that needs to be studied. The long-lasting traumatic effects of violence among individuals and communities needs to be studied. The risk and suicide prevention strategies among our veterans needs to be studied. Yes, there's single small type of studies and case studies and even population studies that are occurring right now around gun violence that show promising prevention and intervention strategies, but we need more. We need a coordinated network of research initiatives and programs developed from a national agenda. We need mental health approaches and faith-based approaches. We need hospital-based programs and credible messenger interruption. We need in medicine to move from a reparative care model to a prevention model, all with a lens towards decreasing gun violence. I'll close with this. Gun violence is not a problem of the other or someone else. It's an American problem. It's just not a problem of the active shooter at a school that my kids don't go to. It's not just a feud between men in the inner city that I don't live in. It's not just an argument in a trailer park. That's not my community. It's not just a depressed, isolated old man that is not my father. It's not just the accident of a 5-year-old who's not my son. It's all of us. It's the entire community. It affects all of us. And in the arc of our lives, we all know someone that's been affected by gun violence. And if you're a physician like us, you see the lack of funding and failed policy showed up in our exam rooms. And if you're like me, you see it on our autopsy tables on cold steel. So now what? We're in an exciting time in American history. We can decrease gun violence. We can. If we're willing to be bold, if we're willing to put safety over politics, if we're willing to put life over death. But we must fund comprehensive gun violence prevention research today. So join this effort and support research funding dollars going to gun violence research. Thank you.
Thank you, Dr. Mitchell.